Hi, my name is Jessica Nickeran, and I support programs at the Child Neurology Foundation. What you are watching now is part of our ongoing series on what children with neurologic conditions and their families are experiencing as a result of COVID-19. These sessions bring together caregivers and health professionals to provide their expertise to the child neurology community. Today, we are with Al Freedman, a parent to a young man with a neurologic condition who receives home health care, who will be interviewing Autumn Lincoln, a home health care provider, about how COVID-19 has changed families' approaches to home health care. At this time, Al, can you introduce yourself?
Sure. Thank you very much, Jessica. My name is Al Freedman. I'm located outside of Philadelphia, Pennsylvania. I'm the father of a 25-year-old young man named Jack, who's affected by spinal muscular atrophy, a neuromuscular condition. And Jack requires home care from nurses 24 hours a day because he has a ventilator, a wheelchair, feeding tube, and many complex medical needs. So we're very grateful for the nurses who take care of my son, and happy to be of help with this interview of Autumn today. Thanks for having me.
Great. Thank you so much for being here. And Autumn, do you mind introducing yourself?
Hi, Jessica. Thank you so much. Thank you for having me. I'm Autumn Lincoln. I'm the co-founder of Lincoln Healthcare, and we provide clinical and non-clinical nursing services in the home, in the home healthcare arena.
Great. Thank you so much. And Al is going to be interviewing Autumn today. So Al, go ahead. What's your first question for Autumn?
Sure. Autumn, I'm aware, because of my son and the care your agency provides for my son, that some protocols and some training has changed as a result of COVID-19 and the pandemic. Can you talk a little bit about how Lincoln Healthcare has changed your protocols and training as a result of COVID-19?
Yeah, absolutely. In home health, I mean, we're always infection control conscious. However, obviously a pandemic like this has caused some changes, like you said. One of the first changes that we implemented was a 2-tier screening process that all of our care providers have to screen every time before every single shift. So we implemented those. Those are mandatory and required of our team. PPE equipment is being required at this time as well. The additional education that we're doing is also a part of it, just making sure that our nurses have a clear line to education, whether it be through a learning management software that we use or with our clinical management team. With their supervisory visits, making sure that we're doing ongoing education about infection control and the processes and protocols that we've put in place for COVID. Also, just really putting a survey out, giving space for them to have a voice and staying in constant communication with them. I think it's really important that we are able to communicate with them at a critical time like this to make sure that we're covering all of our grounds.
Thank you. Are the protocols you're following consistent with what other home healthcare agencies are doing as it's directed by CDC guidelines, or should families specifically ask their home care providers about their policies and practices?
Well, I don't know what everyone else is doing, but absolutely yes, they should ask and they should know what the policies are. And not only what the policies are, but who's creating the policies and who is enforcing and monitoring the policies. I think that's even more important than just the creation of the policies. Oh, look, my cat came to our interview. The life of being at home right now on lockdown here in Philadelphia. Yeah, so I think, yes, absolutely, yes, you should ask your agency. And more importantly, I think that really know who is monitoring the protocols, because anybody can create them, anybody can implement them, but then what does the team look like that's actually monitoring those protocols?
Thank you. Autumn, even before COVID-19, families like mine needed to be, and who are very aware of risks of infection. We've had to protect our family members from infections before this. How has COVID-19 changed families' approach to home health care? What changes are you seeing in families that you're caring for?
It has really varied to each unique family's situation. Home health care is such an individualized setting that everyone has handled it a little differently. We have seen some families that have actually placed care on hold. We have seen some families want care increased, and we've seen some families really not seem to notice much at all, surprisingly, shockingly. But we've really seen it across the board very different.
What precautions or what additional precautions can families take to keep the virus away from their family members? And should families like mine require caregivers to change their clothes outside of the house, not wear clothes or shoes that have been outside the home? How far should precautions go from your perspective?
Without any indication of exposure, that is a great best practice if it can be managed. Obviously, we can't be asking nurses and caregivers to drop naked, outside the home when it's not appropriate. But it is ideal if they can bring a change of clothes, and that is one of our protocols. That's mandatory if they take any form of public transportation, that they bring a change of clothes, and we recommend it to our nurses to have a change of clothes sealed. And if you can't provide a space that's comfortable for them outside of the home, then we are asking them to go into the bathroom immediately upon arriving and changing, washing their hands, those sort of things. So it is a great best practice. It's not mandatory unless there is an exposure, then I would personally create it to be mandatory. But I think that for the most part, if they can change it, I think it's great. And the basics are, I know we've heard this now for months, these basics of washing our hands for 20 seconds, 30 seconds, and cleaning, disinfecting, frequently touched surfaces. And it's probably now going in one ear and out the other for some, and those are really great things that we all need to keep doing and not forget about. And they seem simple, but they work. So.
And our nurses are professionals who know a lot about spread of infection, and they've taught us a lot over the years about how to keep Jack safe. So we, in a certain respect, families like mine, we already have a lot of practice, and we've just stepped it up a notch with the masks and the gloves all the time, and the shoe covers, and mindful of clothes and possessions. I think a lot of us have a lot of years of experience doing this, and this is now just a more heightened sense of what we already have done.
Absolutely. A lot of families, just like yourself, could be teaching a lot of us a lot of things right now that the world is experiencing that you guys already know. This is something you're used to doing to keep your loved ones safe. So yeah, for sure.
I'm wondering, Autumn, are there certain types of services that can be managed in the home without an outsider coming in? How does a family determine what's really essential right now?
I think that that's a really individual decision. I think every family has to make a decision of what is the well-being for the entirety of the home, and it really depends on how your care plans are written. Get creative, think outside the box. If it is in your care plan to have a provider help support you with errands or shopping, maybe they can do that and you're providing care for your family member. Or if that's not manageable, all of your protocols should apply to any type of service that's coming and going from your home. But it really is an individual decision. And the emotional well-being of your home is just as important as the practical things. And so some of that comes into play is that families are starting to feel overwhelmed, and limiting access to some of those services may, heighten that anxiety, that level of anxiety. So it's really an individual decision with the family, and just communicate, collaborate with your agency and the team there. And they would probably have some best practice tips that they could give you if you continue those other services.
The other thing I've noticed and experienced is that our nursing supervisors are not coming into the house in person. they're doing their supervisory visits through telehealth and phone, and they're leaving supplies at the door for us, gloves and masks and different things. So that minimizes some exposure while we still have the care of the nurses in the home. And that's
Absolutely.
one helpful way of minimizing risk and having fewer people in the house. Autumn, what if even when we have all the precautions taken, we find out that a caregiver tests positive or has been exposed to the virus? What should families do at that point, and what are you doing as a home health care agency when there is exposure to the virus?
Yeah, unfortunately, that is a possibility. The first thing is to notify either your agency, your primary care physician, all, your physicians, that there has been an exposure. And there should be, like in Lincoln Healthcare, in our agency, there is a heightened level of protocol that we would go to, where the additional PPE would be required. There would be quarantining in place of the family, and that person would obviously no longer be around. And there would be some tracing, some contact tracing that would go on. So really just tracing, advancing your protocols, your safety protocols, and informing your entire team, your healthcare community.
We had one nurse who was quarantined for 14 days because a family member tested positive, and we were sorry that she couldn't take care of Jack, but we were grateful for the caution and the care and the thought that was put into that protocol to protect our son. And thankfully, we had other nurses who could fill in for her. And she's back now, and she was fine. But we all have to play it safe, obviously.
Absolutely.
I'd like to talk a minute about medical equipment and supplies. My son has a ventilator in the home, and we typically get monthly deliveries of supplies. Are those supplies continuing to be available to the families you serve? It's one thing to have the ventilator, but there's tubing and lots of different supplies that we receive. How's that going for families out there?
In our community, it has not been a problem. We have not seen that problem arise. I think a lot of the families have learned in the past to make sure they have extra supplies on hand. I think they're really wise with that. And we have not seen a delay up until this point. I don't know, what about you? Have you seen that with?
We've had a few things back ordered, but come late. And one particular supply, a bacteria filter for the ventilator, they're only allowing us to have one instead of 4 a month, because the supplies were diverted to hospitals, understandably. So personally, I've gone on to eBay and purchased some extra supplies, and families like mine trade supplies all the time to help take care of each other. So yeah, we find creative ways to make sure that we have what we need for our kids, and so far that's working out for us okay.
That's great. And the clinical management team it can be an advocate as well with your agency if you're not getting what you need. We haven't experienced that, but if a family was experiencing that, I would highly recommend that they reach out to their agency so that their clinical team can provide advocacy to help them get that.
Yeah, and the other thing, Autumn, that one of your nurses has done to help us is to teach us how we can extend the life of certain supplies safely by cleaning them carefully. Some of the supplies can be used longer than they are under normal conditions. So we've also immediately went into a mode of extending the life of supplies. And as long as our nurses teach us how to do it safely and help us do it, then that's another way we preserve supplies. That's been really, very important. How about hand sanitizer and the bleach wipes? They're hard to find in the store right now. Who's responsible for providing these types of supplies to nurses and to families, and how do families get them? How's that working right now?
That's a tough one because our agency provides hand sanitizer all times, not just during a pandemic, as a best practice. It's not required in any type of regulation, but as a best practice, we do. However, we have actually had a hard time obtaining it. So we have even gone to ordering the big bottles and dividing them up to try to disperse it and get it out there. And I think that really it's not a matter of who's responsible, but let's just work together. As a family, if you find it, get it, and let's work together and support each other through times like this.
exactly what's happening. We're all sharing with each other. Families are sharing with each other. Families are sharing with nurses. Nurses are sharing with families. One of your nurses made masks at home, made cloth masks, and brought Jack. And her friends did it. Her friends wanted to help and knew who Jack was, and made a whole bunch of masks and brought him over. So everybody's being creative and pitching in all kinds of ways. That's the way things work for everybody right now. Are there nurses who live in clients' homes? Some people may be wondering about that. Do you have live-in nurses, and do home health care agencies have nurses just stay with a family under these kinds of conditions?
It's not something that we typically do. It's not highly advised. I guess you can imagine how difficult it is just living with our own husbands and wives and families sometimes, that it brings its own set of challenges. It does happen, and there are some special situations where it works out very well, and it is in the best interest of the patient. But for example, a snowstorm. We have had nurses hunker down in homes knowing that there was a big snowstorm coming, just on a temporary basis. On a long-term basis, we have seen that it usually, for the most part, does not end well. A lot of professional boundary issues, ethical issues that arise, because this is the nurses and the caregivers, this is their workplace. So in those situations, when there are rare situations where it works well and is what's best for the patient's care, then, make sure that they have their own private space, they have their downtime, they can't work around the clock, those types of things, and have the discussions up front about the do's and don'ts and what we prefer, and on all those type of typical relationship questions that could help prevent anything. And this might present a time for some families that it might be what's best for them. Our agency personally does not have that right now going on. Like I said, we've done it in snowstorms and inclement weather, but it's not happening right now.
Yeah, snowstorms is when we've had a couple of situations where nurses have been stuck. Unfortunately, have a separate space where they can stay, but that's rare. That's the exception, not the norm in my own case too. There aren't a lot of nurses to go around. Nurses are at a premium in home care. Families like mine need to have more than one agency sometimes. In my case, your agency is one of 4 that care for my son, because there aren't enough nurses in any one agency to provide the level of care we need. How does that work for families and for an agency, Autumn, when families are interacting with more than one agency to provide care?
It's difficult. That provides a lot of added challenges. The continuity of care, the communication between agencies is so important. And then minimizing and mitigating your risk of exposure, it's much harder to control. Unfortunately, it has to happen in some situations, like you're saying, for yourself, but it definitely adds a whole nother set of challenges for families. And, just really get in there and know all of the agencies and know all of their protocols and what is expected of all of their nurses. And the different agencies might have different protocols and requirements, but knowing those will help kind of mitigate the risk right now of exposure.
Yeah, it's another example of us all needing to work together. And
absolutely,
families like mine do. One more question, and it's a hard question, which is, if a child under care begins to have symptoms, which could be COVID-19, could be something else. Our kids are medically fragile. That's why they need nursing. In your opinion, are kids safer continuing with home health care, or better to go to the hospital? And how would they make that difficult decision under these circumstances when, under normal conditions, we never want to have to take our kids to the hospital, but we have sometimes. I've had to many times. What's your opinion about home or hospital right now? It's a tricky one.
That is a tricky one with everything we're seeing on the news right now with facilities and exposures. Obviously, there's been a lot of research about home health being the safer place in some situations. However, like your son, it really depends on the acuity level of the patient. Your doctor, it's all about the relationship you have with your doctor and having that trust in that relationship, because he or she is going to be the one to make that call, not the agency, but the doctor is going to be the one to make that decision for each family, because each one is so unique, and some can be continued at home, and some cannot.
Thank you. We all hope that none of our families are faced with that need and that decision. Autumn, thank you. I appreciate the thoughtful answers to these complicated questions, and I'm very grateful personally for the quality of care that my son is receiving from your agency as well as the others. I'm very grateful, and I appreciate you taking the time to share your expertise with us today. Thank you so much.
Absolutely. Thank you so much. Thanks for having me.
Thank you so much to you both. That was really great. And that's going to conclude today's conversation. But of course, this is something where we need to keep the conversation going. And so for additional resources on home health care during COVID-19, but other things that are also happening at this time and facing our community, please visit childneurologyfoundation.org/COVID-19. And remember, together we will get through this, and together we are all child neurology.